I'm Dr. Felix Yap. I'm the dermatologist in Sunway Medical Center.
Hi, I'm Dr. Cheah. I'm the rheumatologist working at Sunway Medical Center.
Psoriasis is neither contagious or infectious, and treatment is basically long-term. We are looking at making friends with the disease.
Totally agree with Felix. Psoriatic arthritis is a long-term chronic inflammatory disorders. Unfortunately, there's no cure for it, but with effective medication or treatment, the aim is to bring the disease under control, i.e. in remission. So first of all, need to ascertain what sort of pain the patient is suffering from, whether or not this is an inflammatory joint pain due to the uncontrolled psoriatic arthritis, or is it because of the mechanical joint pain due to the existing damage or overuse. So it's an inflammatory joint pain we are looking at, which is actually worse in the morning with morning stiffness and then relieved with a good dose of a painkiller, then you know that your treatment is not effective enough. Then you need to seek treatment. You need to consult your doctor's rheumatologist in order to find a more effective treatment. Okay, if it's because of the so-called damages that happened and that lead to mechanical joint pain, then it's more towards so-called physiotherapy, rehabilitation, and weight reduction or weight management. So a simple analgesia will actually help in terms of managing the kind of mechanical pain, but anti-inflammatory or effective anti-PsA treatment will be needed to treat the inflammatory arthritis.
For nail psoriasis, firstly we need to see whether this is the really nail psoriasis or there is combination of nail psoriasis plus fungal infection. If it's fungal infection, then we treat the fungus, your nail will look better. Fungal infection of the nail cannot treat with cream. You need to treat it with oral medications. As for nail psoriasis is a very chronic kind of skin disease. And nails grows very, very slowly. So even if we give effective treatment, you need time. Basically, a very mild nail psoriasis can be treated with topical cream or topical lotion. But most of the time for severe nail psoriasis, we need either an oral medication or a biologics to treat it.
We look at nail psoriasis, we will be concerned about the future development of psoriatic arthritis because this is one of the risk factors of future development of psoriatic arthritis. So we look at the patients to assess whether there's any pains and aches, any tender point which is suggestive of enthesitis or any swollen digits or dactylitis or any inflammatory back pain feature. Okay, as for treatment of a nail psoriasis, I think Felix has actually mentioned it very clearly. But to our experience, because nail growth is very slow, so the recovery is very slow. So far, I think biologic therapy is the one that's been shown to be very effective in terms of treating the nail psoriasis.
A psoriasis patient are at risk of getting COVID-19 is no. If you don't do your social distancing, if you don't put on your mask, then the answer is yes. Or you have contact with those who has COVID-19, then it's yes. But like anybody else, if you do social distancing, you put on your mask, you do all the necessary hand washing, hand hygiene, then you are not at increased risk of getting COVID-19. Number two is if you get COVID-19, is your risk higher to get more severe disease or you die from COVID-19? The answer depends. If you have cardiometabolic side effect like you are obese, you have hypertension, you have diabetes, all these increase your risk of getting more severe disease or more severe outcome. If you are on certain medications that suppresses your immune system like methotrexate, cyclosporine, yes, you are probably going to get more severe disease because your immune system is being suppressed. If you are on biologics, the answer is no. You are not at any higher risk of getting more severe disease if you are on biologics and you have COVID-19. There are certain studies to show us that those on certain types of biologics actually improve much better compared to those not on biologics treatment.
As for psoriatic arthritis, the answer is the same as well. The disease itself does not put a person to a higher risk of getting COVID or if they were to get COVID, they will become worse. It's more towards, number one, like as mentioned by Felix, the types of treatment on the patient at the point of time, as well as number two, whether or not the disease is well controlled. Mind you that in a patient with inflammatory conditions such as psoriatic arthritis, systemic inflammatory condition, they are actually more immunocompromised as compared to when their disease is under control. So in a patient whom the disease is not well controlled, in fact, their risk is actually in fact a bit higher as compared to those whom the disease are better controlled. Another thing to take note is that high dose of steroids, systemic steroid, does actually increase the risk of so-called morbidity if, let's say, they are unfortunately getting COVID or something like that.
It depends on the supplement. If you are talking about vitamin B, vitamin C, I guess most people do take vitamin B, vitamin C. It doesn't do any harm, neither do it improve the psoriasis. And be careful of supplement that contains steroids. We will never give steroids orally or injectable for patients with psoriasis. Once they are off steroids, the psoriasis will flare up very bad. So let's say you have 20% of your body have psoriasis. Once you start steroids, everything will be melted, everything will be gone. Once you stop the steroid, the whole body will flare up with psoriasis, and it makes your life very difficult and make the doctor's life very difficult, because it's very difficult to treat these patients from there onwards. Psoriasis is a chronic skin disorder that requires long-term treatment. So seek treatment as early as possible to prevent complications. So you do not want your joints and your metabolic effect due to the psoriasis. Make friends with the disease, make friends with the doctors.
Psoriatic arthritis is a chronic inflammatory joint disease. So there's no cure, but effective treatment is available. Therefore, don't delay. Should you develop any signs or symptoms, seek treatment early in order to prevent any irreversible joint damages.